Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of infectious medicine is visceral leishmaniasis. This topic of visceral leishmaniasis will be discussed in three different sections. In the first section, we will discuss what is visceral leishmaniasis. What's the epidemiology of visceral leishmaniasis? What are the parts of the world where it is more common, and what's the parts where it is less common? So, epidemiology of leishmaniasis. And then we will also discuss in this section about immunopathogenesis. What's the immunopathogenesis of leishmaniasis? Then in the second section, we will discuss the clinical features, how the patients with visceral leishmaniasis present. What are the different lab tests for visceral leishmaniasis, and what are the differential diagnoses? What are some conditions that needs to be differentiated from visceral leishmaniasis? Then in the third and final section, we will talk about the treatment options, treatment available for leishmaniasis, which will be the pentavalent antimonial compounds, amphotericin B, paromomycin, and miltefosine. Multiple drug therapy and prognosis of leishmaniasis, and therapy in immunocompromised patients. Immunocompromised patients' disease usually present is more severe, so the treatment for immunocompromised patient is also different than the immunocompetent patient. So all these different treatment options we will discuss in detail. So all these three sections, which will cover what leishmaniasis is, what are the different types of leishmania that cause leishmaniasis, what's the causative or sand flies are usually the flies that carry leishmania and transfer it to the humans or the host. So different aspects of leishmaniasis will be covered in our today's lecture. Keep watching sqadia.com.